How can you tell if you have depression? Today, I'm going to run through the difficulties I see as a doctor in helping people understand when their mood may be low. And by helping you understand these difficulties, I'll be offering you some real strategies you can use to monitor your own mood. Welcome back to The Health Perspective, the YouTube channel I started with the aim of bringing meaningful and real health discussions that I have in my clinic directly to you. I am here to help you understand and navigate your health with more clarity and confidence. So make sure you watch till the end, and remember to please show your support by subscribing or sharing the video with someone who you think may benefit from watching it. Now, one of the commonest issues I encounter in my practice is people seeking help late for low mood or depression. People often come to see me months or years after the symptoms have started to interfere with their daily lives. And often we assume that this is primarily because they feel ashamed or fear stigma, both of which are undeniably massive and important barriers. But I've come to realize there's another big reason at play here, and it's this. People genuinely struggle to spot the signs of depression in themselves. It's not that they are avoiding an issue, at least not all the time, but it's that they genuinely have no idea something is up. And this is what I want to break down for you today, because if we can understand this, we can potentially save ourselves a lot of suffering down the line. Now, there are two real reasons why people struggle to spot depression in themselves, but they are kind of linked, so I'll break them down together. Firstly, it comes on slowly. Depression rarely arrives overnight. It typically creeps in quite gradually. Secondly, depression is directly linked to how we perceive and judge our own thoughts and feelings, our sense of self, which makes it even tougher to gauge whether something is wrong. So, while stigma and shame can prevent someone from seeking help, there's also this quieter, kind of subtler barrier, which is that when things evolve slowly, it can be difficult to actually tell if they're abnormal. And this is particularly challenging if you're someone who's always been prone to negative thinking, because it's all too easy to attribute worsening low mood or heightened anxiety to your inherent personality rather than recognizing it as a potential red flag. Let me give you an example. Imagine someone develops a serious medical problem like appendicitis. So you'd get a severe stabbing pain in the right side of your tummy. And that's a sensation that most of us are not accustomed to having. And therefore it stands out as blatantly abnormal. With depression, however, that shift from mildly negative emotion to clinical depression can be quite subtle, especially if you're somewhat used to feeling low or stressed. And the more gradual the onset, the harder it is to notice that your baseline mood or thinking patterns have deteriorated beyond what would be considered normal. And so, if you are someone who's harbored negative thought patterns for most of your life, new or worsening symptoms can just feel like another bad day. And rather than seeking help or questioning if the feelings are a sign of a deeper issue, you simply accept it as part of who you are. And this can result in your symptoms going on for far too long. Because by the time you realize something is seriously wrong, the depression may have already impacted your relationships, your performance at work, or even your physical health. And so one of the tips I give my patients in clinic is that I always encourage them to use some kind of objective measures and ask themselves direct questions about their mood and mental health, because our own perceptions can be quite unreliable when it comes to these subtle shifts. So here are a couple of really important screening questions you can ask yourself right now. Number one, during the last month, have I felt bothered by feeling down, depressed, or hopeless? Number two, during the last month, have I been bothered by having little interest or pleasure in doing things? Now, if you find yourself answering yes to either question, it's not a diagnosis of depression, but it could be a strong indication that you're dealing with significant low mood rather than just a passing bad day or a personality quirk. And the other thing to look out for, which can help you from an objective perspective, are the so-called biological symptoms, the physical symptoms of depression, because these can further confirm that something more might be at play. For example, disturbed sleep, whether it's insomnia or sleeping too much, changes in your appetite or weight, either up or down, persistent fatigue, loss of energy, and difficulties with concentration or memory. These can all point to something deeper than just a bad day. And of course, probably the most crucial warning sign is recurring thoughts of death, feelings of being worthless, or suicidal ideas. Those are never normal and should always prompt you to seek help. Now, you don't need every one of the symptoms I've just discussed to have depression. But if you're noticing a few and they're lasting weeks or months, it's worth taking seriously. And because depression can be so insidious, mood tracking can be super helpful. This could be a simple journal, a daily rating on a calendar, or using a mood tracking app, whatever works for you. Because by recording how you feel each day, you create a real-time log of your emotional landscape. And over weeks or months, you can look back and see if there is a clear downward trend. Without that kind of objective measure, it can be quite easy to rationalize away or just outright miss a slow decline. And that is the reason why I see so many people in a crisis by the time they finally make it to my clinic, because they only realize something is seriously off when they cannot function in their job, maintain their relationships, or when friends and family express major concerns. So if you suspect you might be on that slope but aren't sure, those objective tools, screening questions, and mood tracking can be invaluable in giving you an earlier warning sign. And why is this important? Well, because it allows you to take action quicker, and taking action quicker can make an enormous difference in treatment outcomes. If you catch depression at a relatively earlier stage, at a milder stage, you might be able to address it with counselling and lifestyle adjustments. But if you only realise when you're fully immersed in the darkest depths of the depression, it often may require much more intense treatment and may mean a much longer and painful recovery. I'll be including some resources in the description below, so if you or someone you care about needs additional information or support, please check them out. And it's crucial to remember that if anything in this video resonates with your current experience, if you're worried that your mental health might be declining, please reach out for professional help. That might involve talking to a GP, a therapist, or a mental health hotline, depending on the urgency of your situation. And remember too, that getting help early can be the key to preventing depression from taking a stronger hold on your life. I encourage anyone feeling even a hint of concern to reach out sooner rather than later. Take care of yourself, and I look forward to seeing you in the next video.